It is a great honor to present the latest guideline from the EAACI Guidelines on Environmental Science for Allergy and Asthma project on behalf of the panel and my working group co-chair Isabella Annesi Maisano. This paper marks the first time the GRADE method has been applied to develop evidence-based recommendations for prevention and public health action in pollen allergy. The panel focuses on 4 PICO questions. The first is, should we recommend reducing or avoiding pollen exposure? The answer is yes, with a conditional recommendation. In fact, there is moderate evidence that pollen exposure raises the risk of severe asthma exacerbations. Second, there is a low to very low quality evidence on the economic benefit of pollen avoidance in reducing asthma symptoms and exacerbations. Question 2. Are biomarkers recommended for monitoring pollen-induced asthma? Both a fall in FeV1 and an increase of FeNO may predict pollen-induced exacerbations. Recommendations are conditional based on low evidence. However, these functional and biological markers play a key role in phenotyping asthma and personalizing therapy. Question 3. Are mitigation measures effective? Yes. Airborne pollen concentration reliably indicates exposure, and real-time monitoring with dispersion models is state-of-the-art. Pollen forecasts and apps help manage allergies, including pollutants data is highly recommended. Nasal filters, FFP2 masks, car filters, and HEPA air cleaners all reduce pollen exposure. Integrating these methods into a unified plan is more effective than using them separately. Question 4 addresses thunderstorm asthma. There are 2 recommendations here. First, with moderate evidence, emergency and asthma-related services should be reinforced during pollen season and whenever a thunderstorm asthma event is likely. Second, based on expert opinion, combined early warning systems that integrate forecasts of weather, pollen, and pollutants may reduce the impact of these events. In conclusion, the strength of the recommendations ranges from low to moderate because of the scarcity and heterogeneity of literature. While dedicated trials are still needed, these first grade-based guidelines provide healthcare professionals and policymakers with a practical roadmap. Pollen monitoring, early warning systems, and greener, allergy-safe urban planning should form the pillars of health services and environmental policy, with a shared aim of reducing the burden of respiratory allergy. Thank you for your attention.